The following is brought to you by VerticalVet. Rethink your GPO.
Hello, VerticalVet family. I am Dr. Ernie Ward, Chief Veterinary Officer for VerticalVet, and it is my highest honor to welcome you to another episode of our Vet Med School webinar series, where we bring you medical topics of interest to your practice and your patients. And this week we have got a really hot topic sponsored by our dear friends at ElleVet Sciences. And let's face it, guys, we hear a lot of noise, a lot of news about cannabinoids and cannabis and CBDs and CBDAs and Bs and all this stuff, and sometimes it can be a bit overwhelming for a busy veterinary professional. Today we've got an expert, a dear friend of mine, someone I've known for a long time, who has studied CBD for many years, and he's now working with ElleVet to kind of make sure that you as veterinary professionals have the best information available as well as the best products. And of course, we're going to be talking all about cannabinoids. We're going to talk primarily about CBDs and CBAs, but today we are so fortunate to have with us Dr. Joseph Wakshlag. And guys, he has been at Cornell University for the past couple of decades. Go Big Red. He actually graduated there, both his DVM, his PhD, did his residency there. He is a full professor there now, I think. So, I mean, he's just done amazing stuff. And if you are like me, who studies nutrition a lot, you cannot go 5 steps or look at 2 papers without seeing his name. Again, he's been teaching nutrition for 20 years at Cornell. He's been leading the field with CBD, CBDA, hemp use in veterinary medicine, and he has over 15 publications on cannabinoids. And again, he's looking at all species. So we're going to talk a little bit about that, the differences between that, and efficacy of how we can use cannabinoids to treat things like pain and seizures and maybe even pruritus. So, Dr. Wakshlag, thank you so much for joining us today.
No, thanks for having me, Ernie. I really appreciate this, and I think this is, as you say, a hot topic. So
it really is, Joe. And I'll tell you, there's a lot of noise. And so if you're a busy veterinary professional today watching this, I mean, it's really important. We want to distill it down to you so that you've got actionable insights that you can then take to your patients and educate your clients about. And there's really no better person than my friend, Joe. Joe, as we kind of kick off today's conversation, before we even get started, I still think a lot of veterinary professionals are confused about the term cannabinoids. I have people saying, well, is that just cannabis, or is it hemp or CBD? Maybe just in a couple of minutes, just give us a brief overview of what we mean when we talk about cannabinoids, especially as they, apply to clinical practice.
Yeah, well, I think in 2018 is when the Farm Bill passed, which really legalized the growth and distribution of hemp and hemp products. And that led to a lot of confusion because a lot of people think of hemp as quote unquote marijuana, but it is actually a low THC varietal, really. It's, as we know, strains have been developed over time. So, right now in the veterinary market, what we need to be looking for are quote unquote hemp-derived cannabinoids, which pretty much mean it's primarily CBD or CBDA, which is the natural cannabidiol that's in the plant. That then gets decarboxylated to CBD during processing in some products, not all. And of course, we like the idea that CBDA and CBD together are somewhat synergistic and actually have an improved sort of profile pharmacokinetically in dogs and cats and now every species that we've looked at, including humans. So, it's really about trying to get through all of we'll just say the smoke and mirrors. And so, at this point, we're just trying to get the word out that it does have efficacy and that we should be using it.
Yeah, but literally here, Joe, there's no smoke. Okay, so, that's the really important thing is, guys, this is not marijuana. This isn't pot. This isn't weed. This is a completely different hemp-derived product, and I think it's just really important. Legality is also an issue, Joe. I mean, obviously, there's a patchwork of regulations and all types of laws all across the country. Maybe just at the outset to that veterinarian who's saying, oh, I can't do that. That's illegal where I am. Maybe give them a bit of advice on what they should know and where they can go.
Yeah, I think that's kind of the interesting part is over the past 5 years, we've really had struggles in sort of, we'll say, educating the veterinarian. We actually just have a piece in the AVMA journal recently talking about what the actual practitioner should be looking for in a product. To that regard, the AA, the Veterinary State Board Association, basically now has guidelines for each and every practitioner out there that they can look at, talking about quality control, talking about, we'll say, in essence, the legality. And right now, each and every state has laws that say that you can distribute and produce hemp. And right now, it seems as if every state is, quote unquote, allowing it. And there's a lot of conjecture and opinion from veterinary medical associations, but we have to remember that those are basically clubs that we join in our state, and they're not the Veterinary State Board, who's been extremely silent because it is considered a nutraceutical. And as long as you're doing good clinical practice and utilizing it appropriately, probably based on what's in plums right now, there's really no real risk to the license.
Yeah, and I really appreciate you saying that, Joe. I mean, I know we say that, and many professionals watching this today have heard so many conflicting opinions and rules and regulations from different boards. And the fact is, you need to seek out your state legality. But right now, from a federal standpoint, these hemp-derived products are legal. And so like I said, there's still a lot of confusion. But Joe, thanks for clearing that up. And Joe, this is something that I think a lot of vets kind of overlook. This is not new. I mean, back in the 50s, they were doing research on cannabinoids. In the 80s, back when I was a young veterinary student, when actually the endocannabinoid system was identified, at least in the research, there was a flurry of interest. And then, of course, the legalities shut it down. But I'd like to start off today just by, starting with the differences in absorption, because I think that's one of the things that, right now, if you're just drawing on your experience in human literature and human research and applications of CBDs, you might find it's different in dogs and cats. So maybe speak to that a little bit.
Yeah, it's been very interesting doing research in this arena because we've looked at a various number of species. And right now, I like to just say that dogs and cats are God's favorite creature when it comes to cannabinoid absorption. They tend to absorb CBD better than a lot of other species. And I guess, to that effect, what we're really looking at and saying now is that not only is CBD absorbed better, but across all species, CBDA is absorbed probably 5 to 10-fold better than just CBD. And so I think we have a lot to learn still, but I think we're really kind of making some real inroads in understanding the cross-species application of CBD and CBDA.
Yeah, and I think that's a really good point because right now the primary area of interest is with canine patients. I would argue that, Joe. I mean, obviously, I know there's feline applications, but the preponderance of literature suggests that, hey, as you mentioned, CBDA is it's well tolerated in dogs, and we seem to see the receptors light up, so it works, and I think that's really important. What advice do you have for that veterinary professional out there who the cat owner is coming in saying, oh my gosh, I tried this CBD product for my dog. It helped out with whatever ailment they think it helped out with. What advice do you have for the feline patient?
Yeah, that's where I think we like to say right now, this is our year of the cat, where we're really studying CBD's application in cats with osteoarthritis, interstitial cystitis. And so I think we're going to know a lot more in the next year. But from an anecdotal standpoint, when talking to practitioners, a lot of them really like it, not only for maybe those indications, but also for just anxiety and inter-cat household behaviors, right? So the multi-cat household or things like that. So I think we're seeing the application. Cats are always difficult because it's hard to orally give an oil or a paste to your cat, but we're making inroads there. And I think it's been shown to be safe now, which is great.
Yeah, and I'd just like to echo that, Joe. My experience also has been an inter-house aggression issues I've found, to help. I mean, obviously, those are typically the end of the process. We've kind of tried everything else, and now we're like, well, let's try this one last thing. Well, let's talk about what we're using it for, because I think that's also, ripe for controversy. I mean, lots of people are claiming it does everything. It'll clean your kitchen sink, too. But, let's talk about what the literature, what the research supports as far as using CBD in a clinical setting.
Yeah, I mean, right now there are a number of papers supporting its use in osteoarthritis for sure, for pain and pain management. So I think that's where we see a lot of people really reaching for it. And then, of course, based on all the human literature, we now know that it does help with refractory seizures. And so I think in refractory seizures, we can definitely add it on top or add it on board in general. And this is something that a lot of neurologists are now sort of gaining interest in and starting to utilize. And then lastly, which we didn't really realize, is that the endocannabinoid system is in the skin as well. And it seems to be able to sort of quench the pruritic response, which is, I think, a very important thing to look at as well, because we have a lot of dogs and cats that have refractory atopic derm that aren't really responding. And so this is just another great way to either use it initially or in the mild itch, but also to add it on board with some of the other medications.
Yeah, I'm really glad you mentioned that anti-inflammatory component because it kind of gets lost in the discussion amongst a lot of veterinary professionals, at least in my experience, Joe. And I think that, we're just now discovering, I mean, and we haven't even, there are a lot of ways that these cannabinoids interact in the body, I mean, we've got the ligands and we got all kind of stuff that's active there. And, we're just now discovering. I love the fact that you said it's the year of the cat. I mean, and I think it's okay in medicine sometimes to say we don't have all the answers yet, but we are pursuing them. And so atopic dermatitis is one of interest for sure. And I would recommend too out there, if you've got a refractory seizure case, I mean, Joe, I am like you. This is when we're starting to reach those thresholds of medications. I am starting to say, look, have you considered or whatever? And, I think that a lot early days, people were so worried about, drug interactions and adverse events, but that really, at least in my experience, in my review of the literature, I haven't seen that. What about you?
Yeah, I mean, I think right now we're really finding that the interactions with drugs, particularly anti-epileptic drugs, are very minimal and really not there. And there's been plenty of literature to really support that at this point. Things like nonsteroidals that are often used for pain, there just doesn't seem to be any real interactions at that level. Behaviorally, that's where we don't know as much, but I'll just say that the use with other things like the fluoxetine don't seem to really be a bother. And I think it's always, that next step is that we should really be thinking about it. And in some cases, maybe the first step.
Yeah, and I appreciate that. Obviously anxiolytic drugs are more and more common, Joe. It's a very different world than 30 years ago when I graduated vet school. And so we do have a lot of patients on these types of anxiolytic medications. So again, just make sure you're consulting and looking at what's in the literature. Who knows, things can change. Well, Joe, obviously one of the biggest indications for CBD out there is with anxiety and behavior problems. Good Lord, if you go to Amazon right now, you're going to be overwhelmed and inundated with ads proclaiming that these products are going to cure your dog's anxiety. Talk a little bit about that because, again, one of the things frustrating to me is, we've got to also, as veterinary professionals, find the good products that are tested and they have good quality control, which I know I want to talk about ElleVet and how they ensure that we're getting the right stuff. But talk a little bit about, all this plethora of stuff we see online with CBD and anxiety in dogs and really maybe now speak back to, how do we dose that? How do we help these patients?
Yeah, that's a great question, Ernie. I think that's where we're really finding that there are some probably dose recommendations that are probably not very good that are out there. I mean, folks are starting and using very low doses, zero point 0.1, maybe 1 mg per kg. But I think in anxiety and even in people, they need relatively high doses. Right now we're kind of suggesting that typical 2 mg per kg for various other indications is not going to really quench that situational anxiety or something like that. And that we really have to start looking at maybe somewhere around the 4 mg per kg dose. And so that's where a lot of people are like, oh, it doesn't work. Well, it doesn't work probably because you're not dosing it high enough when that thunderstorm comes along.
Yeah, and what about also duration? Like a lot of people are afraid, oh my gosh, will this make my dog stoned for hours or whatever? Again, going back, falsely equating it with human experiences, but maybe talk about when should you administer it? For example, you mentioned, noise phobias or thunderstorm anxiety associated events. I mean, when would you recommend they start this and, what can they expect?
Yeah, no, I think that the reality is that we know that cannabinoids pretty universally now are absorbed within an hour of actually applying it or giving it to your dog or your cat. And I think that we really need to sit back and say, oh, I'm getting ready to leave the house or I'm getting ready to go see the fireworks. About an hour to an hour and a half before is probably the best time to really start dosing these types of products. And then, the car ride to the vet, going to the vet visit, I think are also great venues to be utilizing this in general. So it would be, I say it behooves people to really sort of think ahead when trying to give cannabinoids for these situational events, for sure.
And I hate to put you on the spot, but again, I agree with you, and certainly the literature strongly supports in dogs and people. It takes about an hour to go through. You got to get to the liver, got to be changed and activated. But what about cats?
Yeah.
I mean, are you seeing any differences in the pharmacokinetics of dogs versus cats versus people?
Yeah, that's where it's kind of interesting. Is I think in dogs and cats we see probably 3 to 5 fold more CBD getting into the bloodstream than we do in people at very typical 1 to 2 mg per kg doses. And I think that's where it's very interesting. It's particularly with the acidic form of the CBDA, where we get 5-fold better absorption of that. And in the human arena, it's very interesting because nobody really studies the acid forms of the cannabinoids. And in humans, they get sometimes 20 to 40-fold better CBDA absorption. And so, I think this whole idea that dogs and cats are pretty similar is being pretty well founded now in terms of their ability to absorb and then it's metabolize the cannabinoids. And there's now some really good 6-month safety data coming out in cats showing that it's very safe at 4 mg per kg every day as a single dose. But I think we often recommend to dose it twice a day at 2 mg per kg to get more steady pharmacokinetics.
Yeah, and I think that's really important too. Just the dosing, keeping it at steady state levels. I mean, that's actually gonna end in success or failure with these products. And I also love the fact that I think early days, two things kind of soured a lot of vets on this, in my opinion. Joe, is number one, we had inferior products. Like I don't even know what we were giving some of those patients. I mean, we were kind of just trusting, winging a prayer, like that seems right. And then the dosing was so low because we were fearful. I mean, Joe, going back 5-10 years ago, not only were we worried about the DEA crashing in the door, but we were saying, wow, what if this really causes some kind of crazy adverse event? Maybe speak to that sort of as we've seen this comfort with not only using it in the clinical setting, right? So now we're not as worried about being arrested for trying or talking about it, but also about, going up on the dose. Maybe talk about the evolution a little bit about our comfort with CBD.
Yeah, and I think this is where most vets should start feeling a little more comfortable with it because, as far as the side effects, it's pretty well established that it's safe. I mean, the original GW Pharma studies were using, 50 and 100 milligrams per kilogram body weight for long periods of time, showing no real detriment. And I think even, right now, we've continued to study what's a 4 mg per kg twice a day dose or what's a 5 mg per kg twice a day dose going to do. And we've seen in various populations, from shelter dogs to oncology patients, that things like 4 mg per kg twice a day or 5 mg per kg twice a day of our product in particular is not really causing any adverse side effects. Occasionally, we see a little somnolence and maybe lethargy, but very often after a week of dosing it, that wears off. And then, I think as far as sort of the liver, and everybody's always concerned about the liver, we never see ALT rises, and that's where a lot of people get concerned. What we do see is an occasional ALP phos rise about double normal. And a very good colleague of mine once said it's probably one of the more useless enzymes unless you're looking for endocrine disease on a chemistry panel. So we don't worry too much.
Right. Causes a lot of consternation and confusion, and that's unfounded. So I love the fact that. Right. Now, if I see an ALT, that might be a slightly different story for sure. I appreciate you bringing that up. But again, it's just been this evolution, and I want, again, if you're sitting on the fence and maybe you had a poor experience in the past, it's really worth your time to check out ElleVet and really look at some of the research and some of the strides that they're making moving forward. And Joe, that really leads me to the final point, but I do have a couple of follow-up questions, so I don't want you to go just yet. But the quality assurance, I mean, the production, how do we know that the sourcing is safe and accurate and precise and, efficacious? I mean, those are all the questions I think that vets should be asking themselves before they recommend one of these products. I mean, if I were you right now, I would not just say, yeah, well, let's try CBD, because I don't think that's a good recommendation. I think you have to be very specific. Maybe let's talk about ElleVet and how your product is different.
Yeah, I mean, about 5 years ago, we actually grabbed a bunch of products off the shelf and looked at cannabinoid concentrations just to see if the industry was kind of sticking to their guns and then, delivering what they say they're delivering. And that was sort of a hit or miss. I would say, over half the companies were doing a pretty good job of that. But, more importantly, there are things that are going to be part of any plant material in general, right? Pesticides can be a contaminant during the actual growing, right? We know that hemp actually is a bioremediator of soil. It sucks up a lot of the minerals, including the heavy metals. And so that's where we have to be sort of have our due diligence in looking at products and saying, have they been tested and are they free of heavy metals or at least below what's considered the safe consumption limits? We have to understand that pesticides could be a contaminant and it should be tested. And, a good company will test for both of those. They'll also test for microbiologics. They'll also test for mycotoxins. And so, a good company will not only, test that probably in-house, which we do, we test all our cannabinoid stuff in-house, and then we send it to a third party to confirm that we have the cannabinoid concentration, and we make sure it doesn't have any of those quote unquote contaminants, including solvents that are part of the extraction process, like ethanol or methanol or butane or things like that. So it has to be free of that, and that's where the Veterinary State Board's AVSB has really set forth guidelines. Like this is what you should be looking for, and our AVMA article that's out, really kind of highlights all those things that the average practitioner should look at in terms of recommending a product.
Yeah, and again, guys, I strongly encourage you to look at CBDs in general, but then specifically know your manufacturer and your source. And that's why, again, at VerticalVet, we're partnering with the leaders in the field. And in this case, it's ElleVet. And again, the fact, Joe, that you have been with them and you're leading the research charge in the veterinary space, it means a lot. It gives a lot of credibility and legitimacy to ElleVet. So again, we're super excited. Guys, we'll have links to all this. If you have any questions, you can reach out to us at VerticalVet or, of course, directly to ElleVet, but we'll give you all those resources. So, Joe, as we kind of wrap up today's conversation, obviously there's been a lot of other indications for CBDs. I mean, we mentioned one, atopic dermatitis, but also talk a little bit about nausea and appetite stimulation. I mean, there's a lot of things that I don't know how comfortable you are talking about this because, I mean, you are a staid researcher, but, there are a lot of vets that are, that are trying this in other ways.
Yeah, absolutely. And I think that's where I think we're seeing some very interesting, we'll just say anecdotal case report type stuff where folks are using it to sort of settle the stomach. We have some great cases where, a dog would vomit every time they got in the car, started CBD for joint pain and stopped vomiting in the car, right, when they went for their ride to the vet. So they were like, wow, we got a 2-for-1 special here. We're kind of a science first company. We have some really interesting, what we'll call neuron cell culture data that's really suggesting that one of the major hormones that's released in the brain to sort of curb appetite, is somewhat suppressed too, this MPY. And so, have we taken that to the clinical realm yet? That's, we'll just say, a minor indication that we probably should do some more work in for things like nausea for sure. Just because we know that it does have some efficacy there. And, we've got a lot of work to do, and we'll probably hit that at some point.
Yeah, and again, the fascinating thing, just as a veterinarian, as a scientist, as a research geek myself, remember that science does one thing, that's observe. We observe the natural state. We observe what happens naturally, right? And then we try to figure it out. We create words and terms and pathways, and that's what we've done here with endocannabinoids and cannabis and hemp is we've just said, what's going on here? And then, of course, unravel that. And that's what, again, disentangling so much of this, Joe, is the purview of people like you, just brilliant scientists and researchers and clinicians like yourself that are helping us unravel the mysteries of CBD and apply it in a clinical set. Any last bit of advice, to that veterinary professional who's sitting here watching this going, I don't know. I mean, I don't know if I still like the idea of giving my dogs weed. I mean, how would you overcome that last bit of hesitancy?
Yeah, well, I mean, Ernie, as you know, I've been doing research at Cornell for about 20 years now, and when the company approached me and said we wanted to study this, I said, I'm like everybody else. I'm a skeptic. But during our osteoarthritis study about almost 6, 7 years ago now, I had people come to my office and say, "I don't know what you gave my dog last week, but my God, she's a new dog." I mean, she came upstairs, jumped on the bed for the first time in 2 years. And, when people come to your office and say that, of course, I was like, well, I hope they're not on placebo. But, when we unblinded the data, it was pretty remarkable to see some of the real, we'll just say, geriatric dog responses. And I say, if you're a vet out there and you're thinking of trying it, try it on the oldest, crunchiest dog where people are just like, God, I don't know how much time he has left. And I will tell you that 3 or 4 out of 5, the people will come in and go, my God, I don't know what you gave my dog, but I finally got my dog back. And that's kind of an important thing. And that's where at that point, I didn't know the science. And I was just like, well, you know what, if it's working and it's safe, let's keep them on it. And that's, I think, an important part is the quality of life.
Yeah, and I love that, Joe. Again, your commitment to helping pets all over the world. I mean, it's unmatched. I mean, as on a personal note, I've admired, respected, always enjoyed working with you. I mean, it's always a great pleasure and honor of mine whenever we are able to share the stage or share the table. So it's always just wonderful seeing you. And again, the fact that you're working with ElleVet means a lot to us at VerticalVet. So Joe, again, I'm going to let you get back. I know you're busy. I appreciate you taking time with the VerticalVet family to help educate on CBD. Again, it's been a real joy seeing you again.
Oh, thank you so much, Ernie. Always a pleasure talking to you. And whenever you call, I pick up and I run, because Ernie is the consummate professional and somebody to be reckoned with. So thank you much, Ernie. Appreciate it.
Thank you very much, Joe. Well, guys, that's it. Another episode of VerticalVet's Vet Med School is in the books. Class is dismissed. And if you want to know more, go to ElleVet Sciences. I mean, again, they are one of our preferred sponsors here. We're our partnerships, to try to bring you products. They're going to elevate your practice. And at the end of the day, guys, as Dr. Wakshlag said, this is about improving quality of life. So if you want to test the waters with CBD, as he suggests, get the oldest, crunchiest OA case you can find and give ElleVet a call, because they are going to set you up and you're going to be impressed, I think, with the results. So guys, on behalf of the VerticalVet family and ElleVet Sciences, our partner, guys, thank you so much. I will talk to you soon. Bye.